We're talking about a major disease condition today, and this disease condition is named gluten induced enteropathy. Okay, so many other people know this disease condition as celiac disease. You understand? So celiac disease and gluten induced enteropathy are basically the same types of conditions. Okay, and they basically just affect the small intestine, all right? Where you have a normal intestine, normal intestine will have villi for absorption of nutrients, okay? But then you have a damaged villi, okay? Like the absorption is closed up. Do you understand? The villi have been turned into different other cells that are not supposed to be in the small intestine, all right? So thereby, this is actually inhibiting the absorption that these villi, these microvilli are supposed to actually subserve. Right? So what is our focus for this video? To discuss gluten-induced enteropathy, also known as what celiac disease. Okay. So moving forward, guys, we said that gluten-induced enteropathy, also known as celiac disease, is a chronic autoimmune disorder that affects the small intestine. All right. So now it is caused by reaction to gluten, and gluten is a protein that can be found in grains like wheat, the barley, and rye. Okay, so looking at gluten induced enteropathy, I'll be looking at the complications, the treatment. We'll be looking at the symptoms. Okay, causes you guys already know is a reaction from gluten, which is a protein that can be found in grains like wheat, barley, and rye. Okay, so guys, when gluten is consumed, it triggers an immune response that damages the linings of the small intestine, all right? Just like you guys saw, it's a normal gut that will be having all those tall microvilli for absorption or increasing the surface area of the small intestine, all right? But when these microvilli are damaged, it's just like you cut off grass, okay? So it's just like when you cut them off, okay, you have this short macrovilli, and this is what we call gluten-induced enteropathy or celiac disease, okay? So now, what are the symptoms or signs of this disease condition? All right, frankly, there will be what malabsorption of nutrients, because those microvilli, their main function is for absorb nutrients, okay? So there will be malabsorption of nutrients. There will be diarrhea. The patient will be purging. There will be abdominal pain because there's something in your stomach that is not supposed to be there, or there's an abnormality in your stomach, so there will be stomach pain. There will be fatigue. You'll be feeling weak because the nutrients that are supposed to be absorbed to give you energy are not being absorbed in adequate amount. Okay, so you feel weak. Then, if nutrients are not absorbed for proper body development, you have weight loss, then nausea and vomiting. Okay, this is because nutrients will now be mixed up with food, because food is supposed to be digested, nutrients absorbed, and just left with the food particles. Okay, so if these food particles are mixed up in nutrients, this is an abnormality, so you feel like vomiting. Okay, so guys, leading to the complications of this gluten-induced enteropathy, if this condition that is leading to the main symptom or sign for this is malabsorption. Okay, so if there's malabsorption, it can lead to many other disease conditions like anemia. You know, anemia, you need vitamin B12 for proper red blood cell formation. You need iron. Okay, do you understand? So if iron is not being absorbed adequately, vitamin B12 is not being absorbed adequately, you have anemia. Okay, osteoporosis could be that you have weak bones. Okay, and all this is still related to absorption of nutrients. Then increased risk factor of infections. This is because your immune system is not properly strengthened, okay, to defend the body against any other things that will be coming out, all right? So you have increased risk factor of infections. Then you have certain cancers, okay? It could be that you have certain cancers because your stomach is not in the right way it is supposed to be, okay? So guys, what is the treatment? Treatment is simply, you know what is causing the disease, so avoid it. Do you understand? You know that gluten is a protein that is from grains like wheat, barley, rye. So if you know that you actually reacting to this gluten, then stop taking anything that has gluten in it. Okay. So treatment involves a strict gluten-free diet, which can help manage symptoms and prevent long-term complications. Okay, so a healthcare professional can diagnose celiac diseases through blood tests and intestinal biopsies. Okay, so it's important to note that celiac disease is different from non-celiac gluten sensitivity, which is a condition where the individual experiences symptoms similar to celiac disease, but without the same level of immune system activation and intestinal damage. Okay, so there's another disease condition that can damage your intestines, but not all of them are gluten induced enteropathy or celiac disease. Do you understand? So guys, that's it about gluten induced enteropathy. And with the aid of these high colored images, I hope you guys understood it, because I'm a typical visual learner. Okay, so seeing these pictures, I won't forget what is gluten um, induced enteropathy. Okay, and that was the main reason why I did this YouTube channel for my fellow visual learners out there. Okay, since there was nobody to stand up for us and do all these colorful videos for us, I'm trying to like sacrifice myself for the next generation to come. Okay, so that's it about gluten induced enteropathy, also known as celiac disease. I'll be seeing you guys in the next one. Bye for now.